thank you to the organizers. This is a phase 3 trial which has been presented as well as published in Lancet Oncology 2023, and it was Sotorasib versus Docetaxel with KRASG12C mutation only. So the background was that already the activity of Sotorasib was proved in phase 1-2 study, where there was an ORR of 41% and a median PFS of 6.3 months. And when this you compare, as such the Docetaxel had an ORR of 10 to 12% with a median PFS of around 4 months. This was the background from which this trial was started, and with the evidence that Sotorasib has better activity as compared to Docetaxel in the second line. So it was a phase 3 trial. Sotorasib was 960 mg OD, 1:1 randomization. The primary endpoint was PFS and the secondary endpoint was OS, ORR as well as quality of life. If you go by the stratification factors, most of the patients had already received first line, that is 45%, and another 50% of the patients had received 2 or 3 lines, and then Sotorasib versus Docetaxel was compared. PD-L1 positivity was there in 70% of the patients, and most of the patients were from the American European side. There was a problem with the slides. Can you change the slide from the console, because here, yes, next, yes, that's it. The primary endpoint was PFS. I think there is a problem with the keyboard, you can manage it later. The primary endpoint was PFS, and the PFS, the 12-month PFS was 24 versus 10, so there was a doubling of PFS with Sotorasib, and the primary endpoint of Sotorasib was met with a statistically significant PFS advantage. Next slide, please. Coming to the subgroup analysis, the advantage of Sotorasib was seen across the group, whether they were less than 65, more than 65, irrespective of the race, region, number of the lines of chemotherapy. The activity of Sotorasib was much better when it's used as the second or third line rather than in the fourth line. With or without CNS metastasis, in the CNS metastasis the hazard ratio was 0.53, which was much better than without CNS metastasis, showing that this drug has some activity in the metastasis also in the brain. ORR, you can also see that this is the waterfall plot, and you can see that it is of course the ORR is better, 58 versus 48, but it is not the ORR, it is the depth of response also. There are more CRs and more PRs with Sotorasib as compared to Docetaxel. The overall survival, there is, as such, the immature data shows that there is no difference in the overall survival. The crossover is not complete, as you can see on the right hand side table, that the crossover is only 40%, that is the patients who progressed on Docetaxel. Only 40% of the patients could go over to Sotorasib, and thus it is an incomplete crossover. But with this data set and this current follow, there is an immature OS, and that OS has not shown any significance. Patient reported outcomes, the various quality of life and patient reported outcomes were checked in various parameters. As far as the health status and physical functioning is there, the blue line is of Sotorasib and the grey line is of Docetaxel. There was some dip in the global health status and physical functioning with Docetaxel, whereas that was maintained with Sotorasib, and thus the quality of life was considered in this trial better with the oral molecule. The side effects, the majority of the side effects with Sotorasib are related to GI, the diarrhea, fatigue, alopecia and transaminitis. These are the major side effects. We talk about discontinuation, that was similar between Sotorasib and Docetaxel, that is around 10%. And if we talk about clinically significant side effects, that is grade 3, that was also 70% in Sotorasib versus 86% in Docetaxel. One thing which was observed, that more the time is there between previous immunotherapy and Sotorasib, and here the median time was taken as 32 days in the trial. The incidence of treatment-related hepatotoxicity was less. So if you are using Sotorasib just after immunotherapy, you have to take care that there is a median gap of 30 days so that you can avoid the hepatotoxicity related to this drug. These are the investigators' conclusion. There was a significant PFS improvement, and thus the primary endpoint of the trial was met, and the median PFS was 5.6 versus 4.5 months, but the 12-month PFS showed doubling from 10 to 24%. The ORR improved significantly, as well as the duration of response and the quality of life. All of them improved, but there was no difference in overall survival. and that was the secondary endpoint of this trial. Acceptable safety profile of Sotorasib with fewer grade 3 treatment related adverse events as compared to Docetaxel. Thank you.